collecting, can you share what you and Dr. Roberts and the group, what you hope to get from the GWAS that might help inform you on research, or what the patients will understand from the GWAS? And then I have a question for Amanda, and then we can please get your questions ready.
Yeah, so I think the key takeaways to the genome-wide association study would be that we identify specific genetic markers for risk or predisposition to cholangiocarcinoma. So we can use that data to hopefully develop a better screening test or an earlier diagnostic test, or it may provide additional insight into targeting specific treatment options. But I think the biggest outcome that we're looking to achieve is developing better diagnostic tests or earlier diagnostic tests, identifying those at risk so we can potentially intervene before the individual develops cholangiocarcinoma.
Perfect, thank you.
Can I just ask a follow-up question about that, if I can? So how do you plan to take into consideration the other risk factors? Are you just hoping that the large numbers will make the work, or which kind of statistical considerations would you use?
Yeah, so factoring in the other risk factors is we collect a patient demographic form for this group, but then when we do with our institutions that we partner with, we have a larger, I think it's an 11-page clinical data repository of risk factors, clinical features, things of that nature, so we can hopefully control for those additional risk factors in our analysis. And we have a great team at the NCI for one, but also Baylor College of Medicine, who's helping with kind of some of those finer analysis details.
And you will collect them longitudinally, right? So
no, so these collections are just one data
just
point.
One
yep,
off.
yep,
Okay.
one off.
Okay, so I just want to say one thing to all the patients and caregivers. I know that this is a situation that you find yourself in that you feel like you're completely out of control. You have no control over what's happening. And there are certain things, and that is a very difficult situation to be in. But there are some things that you can control. Being a participant in patient-powered research gives you the control to help us figure things out. The data that is being collected by Mayo Clinic, the foundation's been supporting that work for 10 years. This is the 10th anniversary of us supporting that work. It's really important. And our relationship with Invitae Citizen, this is a 4-year relationship. And if we can work together as a community, if all the patients we know put their data in there, and then the researchers can have access to that information, and then in certain situations then as well, the pharmaceutical companies can have access to that information, then we can start really getting somewhere. And the dream is that we have enough patients in there that we don't have to do randomized trials, that we could have a synthetic control arm, which means there would be enough data in that data set that these clinical trials we could really accelerate the research and really get to answers so much quicker. So please, if you are feeling like things are not within your control, these are 2 things that you can do today and tomorrow and Friday that help you feel like you are participating in what's happening, not just to you, but to all of the patients globally. So just wanted to say that. So does anyone have questions for the patient registry, for Amanda, or for the GWAS study? Yes, please, go ahead.
Hi, this is a question for the patient registry. Amanda, we were at a table earlier this morning, but I was wondering, that amazing data that you have, is it available to anybody to look up, or does it only come out when you do research studies? Is it something that we should be, making sure our doctors know about to be looking at? If you could provide more information on how that data is able to be viewed, that would be great.
Yeah, absolutely, and that's a great question. I love that. So currently we're a little bit more in the traditional pathway of publishing and presenting at conferences and working towards publications, but I would love for the insights to be kind of immediately available and freely available. So I think that's something we'll continue to actively push forward.
Yeah, we're working on that, and the foundation will be putting out the aggregate de-identified data. But you can, patients who participate can see their entire record, all of their information, but the foundation will be pushing out that aggregate data so that the patients have better insights to what's going on there. And we hope that we'll have a dashboard so that the patients can look for insights as well. So, coming. Dr. Iyer.
Hi, I had two questions about the registry. One was, how does it work for the collection of longitudinal data? Are you continuously able to just collect that, or do you have to sort of continuously email the patient to get them to send their information?
Yes, so at the point that we, initiate the collection, it's of course retrospective back in time, but we do refresh periodically in the future, like depending on project requirements or the type of analyses that we're looking to do. And that does not involve the patient having to do anything, however, other than tell us if they have any new sites of care that they didn't have already.
They just click a box, and
Yeah.
then Invitae does that for them.
That's great. My second question was whether, I'm assuming you collect the date that they join the registry, which may be very different than the date of diagnosis. I'd be very interested to know whether biomarker testing was, in someone who'd been diagnosed 2 years ago, then they join the registry and then shortly thereafter get biomarker testing, because it seems like, getting involved with the foundation, you learn about the registry, you learn about biomarker testing, and suddenly all those things fall into place.
Yes, and I think we actually could do that analysis with the information we have, and I have to hypothesize that based on what we see from the past couple of years, with so many registry participants having their testing done within 30 days, I have to imagine that a lot of it is due to the education from CCF on the importance of this.
Thank you.
Laura?
I
Kiara,
had
any questions?
Someone asked me a question earlier today, and I think I'll kind of reframe it because I think it's applicable for the registry. So the question came up if they have a finding, and the standard of care changes 2 years from now, or something comes up. Is participation in the registry, do you get a blast about something having changed that may affect you?
Not yet, but we absolutely would want to do that. And in fact, that last example that I was describing with the looking for the biomarkers, I think that's sort of the first run at that type of thing, which is, hey, look, we see something in the data. Things may have changed since this time. We want to make sure that you're aware of the latest.
I was interested in my name is Jean. I was interested in the differences between the intra and the extrahepatic and the patterns in the DNA, and that you're looking to get data on intra and extra. What's happened with the perihilar? Is that part of extra? Where is that in between state? And what do you know about it as different from either intra or extra?
Yeah, there's a little bit of echo up here, but the question was, what's the difference between, you said perihilar versus compared to intrahepatic, or the difference between them? Yeah, I guess that's a good question. So we broadly classify the perihilar along with the distal cholangiocarcinoma. So those are all lumped into the extrahepatic cholangiocarcinoma for analysis. But I think that would be an interesting subgroup to look at, just the perihilar, and see if there's any similarities between the intrahepatics, since they are more closely, I guess, in the human anatomy, they're more closely related. But that's something we have not looked at.
So I think that if there are no more questions, we will close the session now. So we are now heading to the break, and we will meet back here at 3:50. And we would like to ask a favor, if everyone could join outside the ballroom so that we can take a group photo, that would be very appreciated. Thank you.